One of the most rewarding aspects of being a pediatric dentist is the ability to form great relationships with their parents. We love to teach and educate the parents in the process because that way we know that there'll be great hygiene practices at home.
For hygiene appointments, we can handle it one of two ways. Well, ultimately, we base it on the child's individual needs. We handle the appointment differently depending on if the child is 3 years or younger or 3 years or older. For children 3 years and younger, we always ensure a private room. This creates a quiet, calm environment for our youngest patients. We also like to bring the parent back. That way they can help hold the child if necessary. We can answer plenty of questions, and they can just play an active role in the child's first dental experience.
Our older children will usually join us in our open concept hygiene bay. This area is great from a safety standpoint. It allows for enhanced communication among clinical staff, and it also allows children to see other children, and then they see that it's not scary at all. However, it poses some challenges as well. For privacy reasons, we usually don't bring the whole families back for the entire visit. Instead, we do our routine cleaning and then bring the parent or guardian back at the end of the visit to speak with the dentist and to give the parents a chance to ask any questions and to go over any treatment plannings.
Parents are sometimes surprised to know that the patients do very well independent of them. The patients will come back with us, we'll do tell, show, do, take them through every single step, and they'll do very well with us. Sometimes when parents are anxious, they bring their anxiousness back with the child. We have a very successful treatment plan when the patient is brave and can focus on our direction only. If at any time your child becomes upset or needs their parents in any way, we'll update you and let you know how they're doing.
Operatory visits usually involve complex treatments. A lot of times we are managing these procedures while at the same time numbing the child. These procedures take place in private operatory rooms that are staffed by both the dentist and the dental assistant. There's a lot of focus that needs to take place. So if we believe it's in your child's best interest, we will kindly ask for you as the parent to wait outside while the procedure is being done.
During an operative appointment, it's imperative for our patients to solely focus on our dentist and our staff members, as we have instruments and equipment surrounding inside and outside of the patient's mouth. At any given moment, a sound, a distraction, could create a dangerous situation for our patients and our staff members.
An assistant will go over the treatment plan with the parent before we bring the patient back. If during the treatment the child gets upset in any way, we come let you know. Afterwards, when the patient is finished, we go over the post-operative instructions and let you know how to take care of the child at home. It's also comforting to know that there's windows in every operatory room. A patient is never left closed off or unattended at any time. We at Children's Dental Health are with them during the entire treatment plan. We want the patient to feel safe and comfortable just as much as the parent does.
Ultimately, we want each appointment to be as successful as possible. Sometimes, in order to ensure a safe environment, that does mean separating from your child for a brief period of time. But in the end, we want parents to be involved. We want them to ask questions. We want them to be engaged in their child's care. And we always welcome that.
We take a lot of pride in our work, and we want you and your child to be happy at all times. We look forward to seeing you in our office.